Football's back. No, I'm not going to put an NFL logo. The Niners represent football. That's all there needs to be said. For all you Cowboys fans, suck it up. Anyway. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. It's kind of interesting what's going on with the NFL stadiums after the World Cup, right? Football, soccer, the football, not football, right? So 8 out of the 11 teams switched back from grass to turf. And a lot of players wanted them to keep the grass, but no, and obviously there's logistics and contracts and, everyone's patting each other's backs because some company makes a lot of money with turf and someone else may make money with grass, and there's probably some kind of contracts, or they just decided. I don't know. It would be interesting to actually get the head of the NFL Players Association versus the team's owners and see what actually happened or what transpired. Like, who has more power? Who do you think has more power? The billionaires or the Team Player Association?
Since it's all turf again, I think the billionaires have.
I think the billionaires won. Yeah. So anyway, for all of you non-billionaires out there, I love grass. It's so much better than turf. Turf gets hot. It doesn't matter what kind of turf you use. You could use bluegrass turf. You could use fancy turf. You could use turf that you put soil on it. I mean, think about it. The players want grass. The players are the one at risk for injury. The players are the ones that you, owners, are paying multi-million-dollar contracts for. And then you got to deal with insurance if they get out and don't make the full season because of an injury, whether it's preseason, we'll get into that, or in season, or postseason, or training camp, whatever it is, right? So I just don't think that the voice of the players, the athletes, the real hard-working laborers is strong enough. Why is it that a billionaire who does absolutely nothing other than buy a team and make a lot of money gets to dictate what the players do? It happens a lot. I mean, Amazon tells laborers what to do, right? You get UPS telling their workers what to do, whatever injury it is. Now, the difference is you get multi-million-dollar contracts in athletes. You're not getting multi-million-dollar contracts for a FedEx employee. Wouldn't that be cool? Like, like it's kind of like the Uber Eats or Uber, drivers, right? Like, there's the driver which has the best rating and everyone wants him. So you want that FedEx guy, that UPS guy. That would be kind of cool. That everyone rates their FedEx and UPS guy, and then that rating translates into what income, salary they make. Oh, that'd be kind of nuts, actually. Anyway, we're not going to talk about that. We'll cut that out. Anyway, so what happened in the preseason, right? First player, Nick Bosa, right? So ACL reconstruction last year. Now he's got tendonitis. Where is the tendonitis? What kind of tendonitis? Why does he have tendonitis? Because he's resting right now, not even playing in the preseason. So let's just talk about, in general, ACL rehab and kinematics. I mean, we've talked about that before. Now, I just want to remind you that it's not just about the knee. What is the knee connected to? Hip, foot and ankle, right? And then from the hip to the pelvis, to the spine, to the body, to the head and neck, all the way down to the ground from the foot and ankle. And we already talked about this. I know. Quadriceps patella, it's crossing the knee joint. Hamstrings, cross the knee joint. Calf muscles cross the knee joint. Hip flexors cross the pelvic hip joint, and they come all the way down, and the rectus femoris, in fact, is confluent down into the thigh and the knee as part of the patellofemoral kinematics. So, does he have hip tendonitis? Does he have knee tendonitis? I'm talking in general for ACL rehab. You can get tightness of your hip, you can get stiffness of your hip, you can even have problems in the opposite hip and the opposite knee because you often have an imbalance. And if you don't work on that balance of your kinematics, your power, strength, agility, endurance, stability, load, and power, and overall flow, then you can affect the knee you're rehabbing. And sometimes the knee you're rehabbing gets stronger in some aspects, and then other times it can be stiffer. We've seen that happen. You get recovery from a knee and you end up with something else. Maybe you strain your groin. Maybe you blow out your Achilles. There are lots of things that can happen. And so more often than not, and we've discussed this before with the ACL, no matter what you do with the reconstruction, it's never perfect. Now, perfection is your native kinematics of your knee. That's your joint center is in place and moves, and your overall tibiofemoral contact surface area and load kinematics and the pressure per square inch are all back to what they were pre-injury. It never happens. No matter what you do with your ACL, no matter who does it, where it's done, or how many ACLs someone has done, all the kinematics data say that there is a shift. There's also a tendency to not fully extend the knee when you walk, so your gait kinematics are affected. There's also a tendency to sometimes protect that knee. And it could be initially, and then it accumulate into multiple other problems. So you can get stiffness in your hip because your hip flexors are contracted, they're tight, you're protecting your knee. You could have tightness in your hamstring. Say you had a hamstring type of autograft. Say you had a quadriceps type of autograft. Say you had bone, patellar tendon, bone. Say you had allograft. All of those things come into play in terms of the rehab. So there's a tendency, once you have your injury, to protect that knee. And then if you don't relearn how to move and regain the strength, balance, flexibility, and overall joint kinematics, where the center of the joint has a similar path to what it was before, you're not going to restore your natural joint kinematics. Now, it'll never be perfect, but at least you'll be able to try and reproduce what you can. Now, can we do that live in humans when they're on the field? Not yet. I'll tell you later. So, however, when you're doing your rehab, all of that needs to recover. There's muscle impedance. It's the softness, flexibility, and overall strength and balance and agility of your entire kinematics, but also your muscle. We've talked about it before. Your muscles, they're ratcheting fibers, right? And then if you have a contracted state versus an elongated stretch state, say you tore your hamstring muscles, right? And then it scars. So there's lots of different factors involved. So what kind of tendonitis does he have? Let's talk about patellar tendonitis. Now, patellar tendonitis, if you think about it, that typically happens here, patellar tendon, right? So if you're overworking your quads or you have an imbalance, and I mean, I don't think that's the case in Nick Bosa, and I'm not saying yes or no. I don't know exactly how the surgery was done, but in cases that used to happen many years ago is sometimes the positioning of the tibial and femoral tunnel affects the kinematics if you're too far forward in one or the other. That's much less common or rare nowadays with the understanding of kinematics. But typically what can happen is that you could have an overuse tendonitis, or you never fully got your strength back, so you have patellofemoral pain because your load kinematics in the patellofemoral joint are not adequate. Yes, exactly. If you're weaker in your quads and don't use and load your patellofemoral kinematics, you can actually have more pain. So it sometimes becomes a catch-22 and a vicious cycle where you're weak and you have pain and you can't recover, but you have to push through that. Now, that gets into open chain and closed chain exercises, right? We've covered that before, so we're not going to get into that. So unfortunately, he's got tendonitis. We'll learn more and we'll update you, but I think hopefully he's back.
How do you cure tendonitis?
So tendonitis is cured with this magic wand. What you do with the magic wand is, and it's cured. I wish it were that easy. So tendonitis can be complex. It depends on where the tendon is, what kind of tendonitis. And more often than not, it's about restoring your overall kinematic balance. And it could be whether it's at the elbow, whether it's in the knee, whether it's in the hip, anywhere you have tendonitis. Now, people have tried regenerative technology. People have tried all sorts of physical therapy, complementary alternative medicine, acupuncture, acupressure, rolfing, all sorts of different physical therapy and complementary alternative modalities for that. But in the end, sometimes it's just, rest. Is it from overuse? And that's a whole other topic, overuse injuries. And so a lot of different factors. And if there's something to do with the kinematics, say he had bone tendon bone, or say he's actually had the quadriceps patellar tendon reconstruction and he's got tendonitis here. Well, that's a whole other ballgame. So it could be post-surgical tendinopathy, tendonitis. Tendonitis inflammation, tendinopathy is just irregular, abnormal, outside of physiologic range. So yeah, there's no simple solution for tendonitis, but hopefully he recovers well and we'll be back.
Is tendonitis something you can, with tendonitis, is there risk of more injury if he pushes through the pain?
So I tried to finish this topic, but he asked me another question. Like I had such a good ending. I was like, and we'll be back. And it throws me, it immediately throws me another question. Could you re-injure it? Could you have other injuries? Absolutely. I mean, you're protective, you have pain, you may not react the same way, your proprioception. I mean, we all know from the data that no matter what you do with ACL reconstruction and no matter how good the rehab is, I mean, the best data comes from a lot of the NHL hockey players where they don't feel totally solid and comfortable on their knee until the 2-year mark. Now, can we shorten that? Can we understand the kinematics better? Well, yes, we can. More on that later. So in the end, yes, you could hurt it. I mean, it's happened all the time. Like, say you stub your toe and all of a sudden you're walking and all of a sudden you trip over something, right? Well, take that even to a pro athlete where he's got some tendonitis and he's running and he has to avoid something. And so he does something a little differently than he would if his knee was normal and didn't have tendonitis. So he's protecting it. So he may not have the same agility, stability, flexibility, balance, and overall kinematics. He may have edge loading, contact loading, so many different factors. He may jump differently. He may land differently. Like if you imagine you got 2 knees, you land, we've all done this. Like if we've hurt one leg or the other, when you kind of land, you kind of like land a little tilted. You put a little bit less weight on your bad leg and your bad knee. And I went through that when I had my ACL reconstruction. I stopped playing soccer, rehab with cycling, and I had access to a bike machine that looked at the power ratio between one leg. And I was 60% good knee, 40% bad knee. That was after a ton of rehab where I was doing like multiple centuries a year of riding. So even if you rehab it well, and I'm not a super athlete, I'm not an elite athlete, although I know you think I'm an elite athlete, I'm actually not, Joey. But I know the audience does, so I just wanted to clarify with the audience. I'm not a superstar. Don't worry. I'm just an average Joe. Not anymore. Not anymore. So, let's just put that out on the table. I'm not a superstar athlete. Don't worry. So anyway, and so 60-40. And then it made sense. And I went through that phase where in my early rehab, I was having pain, anterior knee pain, tendonitis. And I was like, I don't get it. My ACL is reconstructed. And then it was really interesting because you have the surgeon side of the kinematics and you have the patient side. And sometimes they're not talking to each other. The patient side is angry and the surgeon side knows what's going on. And they're both fighting with each other, complaining. So what do? I do what the patient decides to do and go climb a mountain in Hawaii and, stretch out my knee a little bit. Wow, okay. So that's a whole other story. So in the end, tendonitis is a long, drawn-out process. It can be simple in some cases. Rest can sometimes help. Various anti-inflammatories, regenerative technologies, medication, topical, injection, oral, complementary, alternative, physical therapy, all of that. It can all go into play, and eventually tendonitis can heal. Rarely it can become chronic. But we've seen it. We can have chronic tendonitis for a long time. Elbow is a classic example. Knee is a classic example. And Achilles is a classic example. You can get tendonitis. IT band is very common for runners where it can really get bad. I actually dropped out of an Ironman triathlon I was actually going to do because I developed tendonitis in my IT band and patellofemoral kinematics in my patellar tendon because I was overtraining. And so even though I got rid of the patellar tendonitis, my IT band just limited me. I had to stop. But then that wasn't my career. If it were my career, I could have continued. But imagine having a full job as an orthopedic surgeon and trying to do triathlon. It was hard. I know people have done it. I mean, hey, power to you for all of those people that have. It's essentially like a second job. And so in the end, back to where we were starting, just because I went on a little tangent there, somehow or the other, it always comes back down to my knee. Well, that's how all ideas start, right? Innovation, concepts, understanding your own health leads to better patient care, leads to various, innovation and developments, certainly led to a startup and a company and multiple patents. However, right now, I hope Nick Bosa does well and he's back in the game, and go Niners. All right, more football, guys, and we're talking Cardinals. Yes, the Niners logo is up, and it's not coming down because Cardinals suck. Eat it, all right? So what's going on in the preseason? So first of all, I want to send out some love to Jeremiah Love. Why? Because he had a high ankle sprain. Why? He injured it in the preseason. Why? 17 carries in the preseason in his first rookie, rookie is always first, right? But in his rookie year, 17 times. Now, we all know exactly, all the way down in Alabama. Wow, you're right. More injuries happen in the preseason than often in the season. That's why they've changed the preseason. Non-contact, not necessarily non-contact, but the idea basically is you want to reduce those injuries. There's overuse, there's lack of preparedness. Maybe you don't have that full training. Now, for a rookie, it might be different. I mean, he's coming maybe out of college, or he's just wants to prove himself and he wants to be there, and he may do really well. He may be fit enough, or whatever the reason. I'm not putting any reason out there as to why he got the high ankle sprain, but 17 carries does feel like a lot preseason. I mean, he's expected to do a lot because Cardinals suck. I mean, we all know that, right? And so the only bright spot was this rookie, Jeremiah Love, and what happens? They frickin' destroyed his ankle. So, go Cardinals? I don't think so. So anyway, I mean, I shouldn't put any blame to anyone, but we can blame the coach and the trainer and the team and everyone higher up than that, because ultimately they lost their best chance to do anything. I mean, they weren't even going to win any games, right? Right? Probably. Maybe they might win some games, but now probably not. So we've talked about preseason before. We've talked about high ankle sprains before. We're not going to go do a deep dive in high ankle sprains, but I think The most important part is understanding what's happening in the preseason. Training, preseason, season. What is happening with his ankle? What is happening with someone's knee? What is happening with someone's hip? Do we have live kinematics on the field knowing what they're doing? Not cameras from like 100 feet away or 200 feet away, not body measurements and IMUs sitting at the chest and GPS. What does that tell you? You're off by 10 centimeters or a foot, depending on the type of and quality of data. I mean, the kinematics of a joint are sub-millimeter precision. Nobody can do that. More on that later. But could you have predicted this? Could you have recognized that, oh, okay, after his 10th carry, maybe his 12th, or even his 16th carry, it's kind of like, hey, you know what? I see some kinematic differences. You might be a little stiff here. You're off. Your balance isn't quite there. Your joint center isn't what it was from 2 plays ago. So, let's just give you a break. Let's not have you carry. You sit out. Who knows, right? So, overuse, preseason, increased injury risk. Let's put an end to it. Back to you, Dave.
Okay, so high ankle sprains.
Yeah.
If they're bad, you have surgery. If they're not bad, you just wait it out. Right?
Yeah.
So if he's not having surgery to kind of whatever that is, where you whatever, that means it's not a terrible high ankle sprain.
You want me to talk about high ankles?
Just a little bit. Just a little bit. Well, just because, so he's going to be a guy that's going to get drafted pretty high on fantasy.
Right.
And all the voting's coming in the next couple weeks.
Right.
It's a big deal.
Yeah. So high ankle sprain. So you've got your ligaments that go from the bone to the foot, from the tibia to the foot, from the fibula to the foot, multiple ligaments down here. The tibiofemoral ligaments is where you get the high ankle sprain. If you get completely disruption, then the bones completely pull apart and they won't because it's too much. Okay. I'm still strong. Just because I couldn't break that, I'm still strong. So, damn you, ankle! So, a high ankle sprain, if you have mild instability versus, we'll take 2 stark contrasts. It completely disrupts, you need surgery. Repair and stabilization. If it's not something that completely disrupts in terms of the millimeters or, if it's really bad, you get over a centimeter of disruption, then, you will need surgery if it's that severe. So everything depends on that. And my understanding is that he's not having surgery. Is that correct? Correct. And if he's not having surgery, then that means that hopefully he'll be back sooner. So maybe it's not such a big deal, but I think it's a big deal. Your, potential superstar player, rookie, to try and turn around the Cardinals, who are already a horrible team. People are going to hate me, right?
I don't. The Cardinals have any fans?
They don't have fans. Well, then it's easy. We'll just diss them all night long. So So back to you, Dave.